friend, can we talk about snoring for a minute? Many of you talk about snoring like it's a badge of honor that you wear so proudly, when in fact, it's terribly unhealthy and it is something that you should take a deeper dive into. Normal breathing is quiet and it's through the nose. It is effortless and it allows the body to get that deep, restorative, reparative sleep that we all need to wake refreshed and motivated to embrace our day with joy and enthusiasm and a smile. Snoring is the loud, annoying sound that occurs when air flows past the relaxed tissues in the throat and causes those tissues to vibrate. No amount of snoring is okay or normal. Snoring is sleep disordered breathing, and I can guarantee you that it's robbing you or your bed partner of quality, reparative, so very important sleep, okay? So one of my jobs as a myofunctional therapist is to look for the root cause of why you're snoring, not just let you think that it's normal. Snoring can happen for many reasons, all of which are very important to investigate. Snoring, a potentially serious form of obstructive breathing, can be caused by things like oral anatomy, so the development of your face, alcohol consumption, weight, chronic congestion. So I always look at it like, is it a tongue posture issue? Is it that you lack oral pharyngeal muscle tone and that the soft palate is hanging long, soft, and unsupported in your mouth? Do you have tonsils that are the problem? Perhaps that deviated septum that you were told you needed to have fixed a long time ago and you've been ignoring it. What about congestion? Maybe you're causing it inadvertently by mouth breathing, maybe eating things that cause inflammation to your body. Regardless of the cause, we here at Impact Myofunctional Therapy help you get to the bottom of your snoring, and we also help you improve the tone of your muscles and correct myofunctional impairment so that you don't have things that are contributing to your snoring.